4 years I was diagnosed with stage 1 breast cancer and had a lumpectomy. I did not do anything conventional after that, and then through a series of different events found different naturopaths and ended up with the one that you know. And we thought that we were just clearing up circulating cells and that's all I had. I ended up in the ER with a kidney stone, and a huge mass was found on my liver, 13.5 centimeters, and another huge mass in my upper abdomen. And so that was a huge shock. And
it was nothing local.
No,
in the
nothing,
breast, yes.
No. And I had been doing sonograms of the breast every 3 to 6 months for a while, and nothing showed up there. So, you know, we don't know if I was really stage 1 4 years ago or not. You know, there's a lot of question marks there. But my lymph nodes were clear when I had the lumpectomy done, though. So that was all a shock and threw me into a whirlwind, really. And the naturopath suggested strongly that I come see you.
So we went ahead and we did low-dose chemotherapy. And we treated you actually intensively, multiple rounds of this and other therapies for around 11 weeks. And then you bravely went back home to go back to your normal life. And I think that initially you also had a motor vehicle accident before you came, and you were in a good deal of pain. And that slowly recovered as well. So by the time you got home, you were able to do things back, because you're the mom of how many children?
Yeah,
3 kids.
Yeah.
So you went back into that routine. And the principles I think that are important are that stage 4 disorders don't get cured in 3 weeks, and they don't get treated in 3 weeks.
Right.
And I think you, more than many other people that I see, understood that intuitively. You are sad that you had to deal with this, and initially, obviously frightened, and that's completely appropriate. But then you took handle of yourself. You got very, very strict. You began looking healthier by the minute.
I'm so glad I came here because, you know, the diagnosis I got, I really didn't think I had a shot. I mean, I'm from Florida, so we're coming all the way from Florida to San Francisco for this treatment, and I've had a lot of people say, why are you doing that? Why not just go to such and such close by? But my husband and I both felt like, I got one shot at this. You know, this isn't something I want to play with. And I think the approach that you take made the most logical sense to me and to my husband. That I remember you saying from the beginning, there's not a magic sauce. It's a layered approach of many different things, and, you know, keep up with life. And, you know, my desire in beating cancer and living is so I can live, not exist.
Well, I want to say a few things. I mean, to me, you look great. So, I mean, you look very healthy. So, and I told you, I think that sometimes people feel better on our approach, which happens to be low-dose chemotherapy. But you've done a lot, and I congratulate you. I mean, you're a model patient. It doesn't mean you don't have issues every day, and we make rounds every day, and we ask questions every day. And when you get over this, you'll be healthier than all of your friends. And you'll be able, I think, to teach them. Because I think the leaders out there are typically not doctors. They're patients who've gotten over this journey and have a lot to teach. So I always wanted you to consider that as you remember.